So now we've worked into the mobility of the knee, we're going to look at strengthening the knee joint. So it's important to strengthen, as I've said before, the knee itself, but the joints above, which will be the hip joint. You're going to get yourself one of the squishy balls if you've got one, otherwise, again, a rolled up towel or a pillow, and that's going to be placed underneath the knee. From there, you're going to flex the foot, slightly angle it outwards to hit this inner thigh here, which is called the VMO. And from there, support yourself either up against a supported surface or hands behind you as you push that knee flat in towards the object, really nice and hard. And if you push hard enough, you should see that your foot and heel raise off the floor. And you're going to hold that for 10 seconds, really pushing down. Don't give up with this one, guys. It's quite challenging, but keep pushing. And slow and controlled lower back down. Just to recap, you're going to push down really nice and hard. If you push hard enough, the leg will raise. And the good part with this exercise is you can often see that the muscle pumps out just there. It's often quite interesting to compare good to bad. You may have a little bit of muscle wastage, which means that the muscle's worn away a little bit. 10 seconds, slow and controlled lower back down. So you're going to do 10 of those, guys. We're then going to up the ante a little bit by going with a straight leg raise. Now this is hard for someone who hasn't even had surgery. So you're going to flex the foot, turn the foot out in exactly the same way you did before, but this time nothing's underneath the knee. Support in the same way, keep that foot flexed, lift a few inches. Not going to make you hold this for long. 5 seconds, slow and controlled lower back down. So I'll repeat that, flex the foot, turn out slightly, make sure that you're nice and upright, lift a few inches, 5 seconds, and slow and controlled back down. So all of those exercises are repeated 10 times each.